Welcome to the CHCI Leadership Conference Afternoon Plenary, Healthcare After COVID-19. We are grateful to our sponsors, Blue Cross Blue Shield Association, the Commonwealth Fund, Genentech, Eli Lilly, and the Pharmaceutical Research and Manufacturers of America. Our panel chair for this session is Representative Raul Ruiz from California's 36th Congressional District. Dr. Ruiz currently serves on the House Energy and Commerce Committee and the House Veterans Affairs Committee. He is also chair of the Congressional Hispanic Caucus. We also welcome Kim Keck, President and Chief Executive Officer of Blue Cross Blue Shield Association, who will provide welcoming remarks. Our session moderator is Yvette Nunes, Deputy Vice President of Communications and Marketing for Unidos US. Ms. Nunes is the recipient of several awards, including the Pennsylvania's Above and Beyond Award, honoring women of public and civic mind, Hispanic Media's Crystal Award, and the Delaware Valley's Most Influential Latino Leaders Award. Please welcome our opening speaker, Representative Raul Ruiz.
Good afternoon. My name is Congressman Dr. Raul Ruiz. I represent California's 36th Congressional District in Southern California. I'm an emergency medicine physician, the first Latino physician to serve in Congress, and a public health expert with training in humanitarian and disaster aid. I'm also chair of the Congressional Hispanic Caucus. I would like to start by thanking Marco Davis, President and CEO of the Congressional Hispanic Caucus Institute, as well as our wonderful moderator and panelists. It is a pleasure to be with you to discuss healthcare after COVID-19. Information is one of the most cost-effective ways to save lives during a public health crisis. Accurate pandemic public health information helps people to make decisions based on science and facts rather than anxiety and fear that can save lives. The discussion today will provide us with information that will help us better determine how to battle COVID and other healthcare issues in the future. COVID-19 continues to wreak havoc on the Hispanic community across our country. The pandemic has highlighted vast inequities in our healthcare system. It has also shined a bright light on the social and economic factors that contribute to poor health outcomes. According to studies conducted by the Pew Research Center, 52% of Latinos say a family member or close friend was hospitalized or died from COVID. Research from the Center for Disease Control and Prevention shows the Latino community faces a higher risk of hospitalizations and death from COVID than other racial and ethnic groups in the U.S. The CDC attributes this higher risk in part to a lack of access to healthcare and exposure to the virus while working in essential jobs that frequently require close contact with the public. The health and economic impact on Latinas has been particularly and disproportionately devastating. According to the CDC, Latinas were more than twice as likely to die from COVID-19 compared to their white counterparts. And because many Latinas work in the leisure and hospitality industries, they suffered tremendous job losses. According to the UCLA Latino Policy and Politics Initiative, before the pandemic, the number of Latinas in the workforce was projected to grow by 25.8% from 2019 to 2029. However, due to the pandemic, between March 2020 and March 2021, the number of Latinas in the workforce shrank by 2.74%, the highest drop than any other group. Keep in mind that lack of employment is a huge contributor to health insecurity. Achieving the goal of health equity will be a key factor in helping the Latino community overcome the devastating impact of COVID-19. Our government, the private sector, nonprofit organizations, and the academic community all have a role to play in developing a more equitable healthcare system in this country. And I look forward to hearing from our panel on how we can achieve health equity in a post-coronavirus world and ways to ensure enhanced prevention, access to testing, and treatment for Hispanics most affected by COVID-19. On behalf of CHCI, I would like to thank today's panelists for sharing their insights and experiences. I also want to thank everyone in our audience for joining us for a very informative session. Thank you for having me, and thank you, CHCI, for empowering Hispanic communities. Together, we can create lasting change to ensure the promise of America is accessible to the 60 million Hispanics living across our country. Thank you.
Hi, everyone. I'm Kim Keck, President and CEO of the Blue Cross Blue Shield Association, and I'm thrilled to be with you virtually at the Congressional Hispanic Caucus Institute's 2021 Leadership Conference. Your dedication to connect, educate, and empower leaders of tomorrow by discussing issues facing the nation and the Hispanic community is invaluable. And I'm honored to be part of the discussions today. The topic of our next session, Healthcare After COVID-19, is incredibly timely and one we've been keenly focused on across the Blue system. Of course, we're still in the midst of a pandemic, and we're all focused on bringing it to an end as quickly as possible. But at the same time, the past year and a half has really underscored the need and really an opportunity to reimagine our healthcare system, an opportunity to move forward so that equity and affordability are at the forefront. We know disparities are not new, but we also know the COVID-19 pandemic put a spotlight on those racial health disparities. For example, Hispanic people make up 18.5% of the US population, but they currently represent north of 23% of confirmed COVID cases in the United States. And Black and Hispanic people are less likely than their white counterparts to have received a COVID-19 vaccine, leaving the unvaccinated members of these groups at an elevated risk. These disparities are unconscionable and unacceptable. And now is the time for all of us to come together and change the trajectory and build a new model of equitable healthcare and health caring. This past April, the Blue Cross and Blue Shield Association launched what we call our National Health Equity Strategy. And while Blue Cross Blue Shield companies have made great strides in addressing racial health disparities in our local communities, there's so much more to be done. The multi-year strategy will focus on conditions that disproportionately impact communities of color, starting with maternal health. We're starting here because data shows that the rates of childbirth complications have been increasing for women of color. In the last 2 years, for example, the rate of Hispanic women with severe childbirth complications increased 19%. And severe maternal morbidity rates are 32% higher for women in majority Hispanic communities when compared to majority white communities. So our goal? Reduce maternal health disparities by 50% in 5 years. And we're working with community, state, and national health leaders to meet that goal. Health disparities are a multidimensional problem, calling for a multidimensional solution. And that's why it will take all of us working together to reimagine a more equitable future. So this group and the conversations we have over the course of the conference are an incredible example of how we can come together to make the future we're imagining today a reality tomorrow. A healthcare system that's equitable, affordable, and accessible for all Americans, and is sustainable for the long term. Thank you.
Good afternoon, and welcome to the Healthcare After COVID plenary session. My name is Yvette Nunes. I'm Deputy Vice President of Communications and Marketing with Unidos US. I'm honored to help lead this discussion this afternoon. I want to take a moment to thank Congressman Dr. Raul Ruiz for his welcome remarks and highlighting the importance that COVID-19 impact has had on the Latino community. Thank you also to Kim Keck, President and Chief Executive Officer of the Blue Cross Blue Shield Association, for her welcome. And thank you, of course, to CHCI for prioritizing this thoughtful leadership discussion during His Heritage Month, and for focusing on the important topic of Latino health equity in a post-coronavirus world. Please feel free to tweet during this session and hashtag CHCIHHM21. I'd like to take a moment to underscore and expand on Congressman Ruiz's points. As essential workers, Latinos have borne the brunt of this pandemic, physically and emotionally. Without the luxury of being able to socially distance by working from home, Latino essential workers kept our country running as farm workers, domestic workers, food service workers, delivery drivers, and other critical roles that allowed us to safely work from the comfort of our homes. This reality exposed Latino families to a disproportionate impact, as we've all heard. According to the CDC, Latinos, currently 18% of the US population, comprise 27.5% of COVID-19 cases in the United States. This inequality also unfortunately impacts children. As we see the Delta variant continue to spread across the country, the risks for infection are increasing amongst Latino children who are back in school and remain unvaccinated. According to the CDC, Latino children are more than 3 times as likely to be hospitalized for COVID-19 than non-Hispanic white children. And though Latinos early on had a greater share of vaccine hesitancy, spurring efforts like Unidos US's Esperanza Hope for All mobile tour, today 72% of the Latinos surveyed said that they would support employer requirements to have employees vaccinated, wear masks, or implement frequent COVID-19 testing. Similarly, 7 out of 10 Latino parents surveyed said they would support vaccine mandates for all eligible students and staff in order for children to be able to attend school in person. The racial inequalities of our country's health system are now laid bare for all to see. So what's next? I'm delighted to be joined by 4 experts on this very topic. First, please welcome Cynthia Cardona, Senior Advisor, Corporate Affairs at Eli Lilly and Company. After spending the early part of her career in the nonprofit sector working in disaster risk management in vulnerable communities around the world, Cynthia joined Lilly in 2004. Cynthia, thank you so much for joining us.
Muchas gracias, Yvette, and thank you to CHCI for the opportunity to join you today. My name is Cynthia Cardona, and as Yvette mentioned, I'm a Senior Advisor in Corporate Affairs with Eli Lilly and Company. Lilly's purpose is to make medicines that make life better for people around the world. And that's the reason I joined the company 17 years ago, moved my family from California to Indianapolis, where Lilly's headquartered, and why I've worked through my roles in marketing and other areas to ensure people with diseases that we treat have access to information that help enable better conversations with their doctors and better care. The pandemic has highlighted that our purpose is more important now than ever. And COVID has also brought to light the disproportionate impact on communities of color. And this is where, through my work with corporate affairs at Lilly and internal and external partners, and also because of the very personal impact of COVID, which I'm sure many of us share, I'm very passionate about working and doing more to ensure that all people, including the most vulnerable among us, are able to access and afford essential medications and care today and in the future. So thank you. Looking forward to today's conversation.
Thank you so much for all that you're doing, Cynthia. Next, let's welcome Dr. Mike Ibarra, a board-certified emergency physician and Vice President and Chief of Medical Affairs at Pharma. He leads stakeholder outreach on federal and international policy issues and Pharma's internal and external medical affairs engagement. Mike, thank you for joining us this afternoon.
Thank you. Thank you so much for having me today. Thanks to CHCI for organizing this event and for your leadership on these critical issues, as well as Yvette for moderating. Also want to take a minute to thank Congressman Dr. Ruiz for kicking off this panel. Appreciate the connection to emergency medicine, with which Yvette you also made. As you mentioned, I'm a vice president at Pharma. I'm also an emergency physician. And so I've been focused on the pandemic from both a clinical and an industry standpoint for the past year and a half. Plus, certainly the pandemic's brought out the best and finest response from the industry that I'm here to represent, who we've really worked around the clock to develop safe and effective vaccines and therapeutics. It's really changed the course of my own clinical experience. You know, working in an ER today is very, very different than it was a year and a half plus ago. But at the same time, the humbling reality is that too many Americans aren't protected and remain vulnerable from COVID-19. And the pandemic has uncovered so much about the very acute inequities that exist in our healthcare system. system that really existed all along, but we just could no longer hide from because of the pandemic. And I saw that very acutely myself, seeing, as you mentioned, entire families, essential workers, folks living in multi-generation housing, coming in the early days of the pandemic, infected with COVID-19. So we have a great discussion ahead of us here. I really appreciate the opportunity to talk about the work that industry is doing to play a role in addressing these inequities. And thank you again for the chance to be here.
Thank you so much. I really appreciate the breadth of expertise that you have on this topic, and I'm sure it'll serve us all well. Next, I'm pleased to introduce Dr. Marianne Chacon, Senior Director, Cross-Portfolio Digital Health at Genentech. She is a physician with extensive pharmaceutical industry and business experience across Latin America and the United States. She leads a cross-portfolio team in medical affairs that is researching and piloting how to leverage social technologies, digital technologies to improve patient care. Marianne, thank you so much for joining us.
Thank you, Yvette. Thank you so much for having me. And thank you to the esteemed panel for the very important discussion we're going to have for the next hour. As you mentioned, I am currently a senior director for the digital health group at Genentech, a physician by training with experience in business. But the most important part of my introduction is that I'm a fellow Latina. So thinking about how we can really utilize the technology that we use nowadays in our everyday today and trying to innovate and see how we can help patients better connect and improve their outcomes in something that I'm very passionate about. And so bringing that innovation, challenging the status quo, leveraging the learnings we've had from the pandemic, and then thinking about how can we truly personalize care to all of our patients, including the Latino community. It's definitely one important aspect in my life and a driver for what I do every day in Pharma. So thank you for having me.
Thank you so much, Marianne. I'm truly encouraged by the amount of Latino leaders that we have steering us through and out of this pandemic. And last, but certainly not least, I'm pleased to introduce Melinda Abrams. Melinda is the Executive Vice President for Programs at the Commonwealth Fund, where she has responsibility for the development and management of the fund's grant programs. Melinda has worked on the fund's task force on academic health centers and child development and preventative care program. Melinda, thank you so much for joining us. Oh, I don't think we can hear you, Melinda. So hopefully we will be able to resolve that technical issue and can hear from Melinda as the panel discussion continues. Thank you all much to our experts who are joining us this afternoon, including Melinda Abrams, who I'm sure we will hear from in just a little bit. Participants, we'd love to see your questions throughout this discussion. Please be sure to submit your questions into the chat box and we will definitely address them by the end of this afternoon's discussion. I'm going to jump right into it and begin with a question for all of you. We want each of you to talk about your organization and its efforts around providing access to health services to underserved communities impacted by COVID-19. How have you tackled this extraordinary challenge we've been facing as a nation and especially as a Latino community? And we'll begin with you, Cynthia.
Great. Can you hear me okay?
We can.
Okay. So as a pharmaceutical manufacturer and research-based company, as I mentioned before, Lilly's purpose has never been more important. Many significant challenges in its 140-year history, and COVID has been no exception. So whether it was by keeping our supply of medicine intact for the 40+ million people who depend on it every day, to ensuring people who can afford life-saving medications like insulin because of the impact of the pandemic had access to solutions to help them, to quickly helping in the local response against COVID, including vaccination awareness campaigns, which we partnered with to share with the local community, local Latino community and organizations, or to partnering with others in the development of treatments against COVID. The response of Lilly employees, like so many other in the healthcare industry, organizations and workers, is a prime example of why we do what we do and what we can accomplish together. So those are just some of the high-level initiatives that we've taken. Health equity is also something that we're very much committed to. I think the impact of COVID and its disproportionate effects on communities of color is something that we have, also already taken measures on, including strengthening our diversity in clinical trials and our health equity programs and planning and thinking around the topic and different partnerships. So those are just a few that I'll stop and let the other folks on the panel also share.
Thank you. Mike, how is Pharma addressing the challenges faced by the Latino community?
Yeah, thank you, and thanks for the question. Pharma, we're the trade association. We are an industry group. We represent member companies, two of which I'm really lucky to be on the panel with today. Genentech and Eli Lilly are both members of Pharma, in addition to other manufacturers of innovative medicines. So medicines that are new, that require a robust amount of research and development. And industry's response to COVID-19 pandemic's really been unprecedented. Of course, there's really not a whole lot of a template for how anyone should respond to a pandemic, but I think our response certainly was unprecedented as well. And I break it down to a number of issues, of which Cynthia touched on some of them, which I just want to double click on. Repurposing existing medicines early on, identifying medicines that could be potential therapies, donating medical supplies like masks to those early hospitals. If you recall, a year and a half ago, that was something that I certainly dealt with on the front lines, using an N95 for a week when it was only supposed to be used for one patient encounter originally. So donating medical supplies was another area that industry stepped up. And of course, developing de novo therapies. So being able to quickly pivot research and development protocols and programs in order to investigate new therapies for potential pathways to treat COVID-19. And then, of course, COVID-19 vaccines, which we'll talk a lot more about over the course of the hour as well. But that wasn't the extent of it, right? That's industry's response broadly. One thing that we really wanted to do was also bring our membership together and be able to do more to identify some of these underlying issues. How can we better understand what is happening so we can be more prepared for future pandemics? And again, as I said at the beginning, all of these health disparities were there to begin with. They just, we couldn't look away from them anymore because of the pandemic. So we developed a number of programs. One example is CARES grants, where we funded research to better understand the effects of COVID-19's impact on communities of color. And then, of course, we'll talk more about this as well, but industry came together to develop an equity initiative, one that can go under the Pharma banner. Each of our member companies has a variety of initiatives in this space, but we thought that we had a unique role to play as the trade association as well. What could we do to commit to building a more equitable healthcare system? And so our efforts include things like industry action around improving clinical trial diversity, something that's really, really important, something that we actually stepped up on in the wake of the COVID-19 pandemic. Both of the member companies here, I think, can speak to that as well. So a lot of work underway, clearly a lot more work to be done, but those are some examples of how we've approached it in the last year and a half.
Thank you, Mike. We're certainly going to touch a bit on some of those points later in the discussion. Marianne, tell us a bit more about Genentech and the work that you've done over the last almost 2 years now of the pandemic.
Absolutely, Yvette, and I think it's very much aligned to what Cynthia and Mike were sharing. And I love numbers, so I'm going to start with that. We know that about half of the population in the US by 2045, it's going to be non-Caucasian. So that's definitely, to me, an important aspect to take into consideration. So if you grab that, about 6% of patients across the United States participate in clinical trials. Very small number. And out of those percentage, about 5 to 15% are non-Caucasian. So to Mike's point, the opportunity of addressing health equity and inclusive research is the fact that we know even before the pandemic. So then the pandemic comes, what are we going to do about it? So if we think about the gap that exists right now in populations like ours to being properly represented, it goes across the entire clinical journey, from diagnosis to selecting treatment plans to be able to participate in a clinical trial, to understanding the outcomes. How we Latinos behave in our physiology is completely different than Caucasian. And we need data and science to understand that, to ultimately develop the better medicines that are going to help our patients. So thinking about clinical research as an opportunity to provide access to novel therapies, it became very relevant in the pandemic. And we know that early data, as we heard from the videos, were really showing the disproportionate impact, unfortunately, of COVID within our communities of color. So with that in mind, Genentech, being a biotechnology company that is focusing on chronic diseases as well as life-altering diseases such as cancer, we were thinking about what we can do to come into action quickly. And so we have an initiative that I'm going to address a little bit later called Advancing Inclusive Research. But as part of that initiative, we launched a trial that it's called Impacta. It stands for Evaluating Monitoring Patients with Actemra, which is one of our drugs that we utilize for rheumatoid arthritis, where we could potentially see the benefit in patients with COVID-19. So this was a randomized controlled trial for patients with COVID-19 pneumonia that centered around trying to reach a broader population. So we partnered with trial centers and sites that really relay in a location where underserved communities were living. And so with that, you can see that the representation of that trial only had a 56% of Hispanic and Latino. So that 5 to 15% that I mentioned at the beginning of my comment really was a significant improvement in trying to understand how we can better serve our Latino patients with COVID. And this is just one of the many examples. I'm going to address more when we continue the discussion.
Excellent. For our audience, if you haven't noticed by now, you should have pen and paper ready to take notes. Our experts are a fountain of information and data that we can all use to move forward in our communities as we help them overcome and come out of this pandemic. And with us, Melinda Abrams with the Commonwealth Fund. Melinda, can you talk a little bit about how the Commonwealth Fund is helping increase access to health services, especially in underserved populations throughout this pandemic?
Absolutely. Thank you so much. And thanks for inviting me, Yvette and CHCI. It's a pleasure to be here. For those of you less familiar with the Commonwealth Fund, I just want to take a minute and tell you who we are and what we do.
Sure.
The Commonwealth Fund is a private, nonprofit, nonpartisan health policy research foundation. Our mission is to create a high-performance health system in the United States, which means that we aim to assure that all Americans have access to high-quality, equitable, and affordable healthcare. We are an old foundation. We're celebrating our 103rd birthday next month. And as a core value of the Commonwealth Fund, it has always been about really trying to create greater equity, whether that is by race or thinking about in terms of gender or geography. So that's just kind of broadly what the Commonwealth Fund is about. As an organization, and we do no fundraising because we're very fortunate that we don't have to do that, but we do no fundraising. As an organization that supports research and evidence-based policy options, we have a long history of documenting the need for affordable, accessible care. And a lot of what we spend our time doing, always, but especially since COVID, when we pivoted, is really providing timely information about people's healthcare experiences, both with insurance, those that are underinsured. We monitor policy options, we analyze those options, we identify gaps in coverage, we examine them by race and ethnicity, and whether it's like urban versus rural. We examine new delivery models, particularly, and evaluate whether those models, the way that they're taken up by different communities and ways that they can be improved. Our largest program at the Commonwealth Fund is our Advancing Health Equity program. It was recently launched. We've had a long history in vulnerable populations, but we went to our board and asked for a special health equity action fund during COVID. So it's a $15 million fund that we plan to spend in about 3 years. And we have also done a lot of work at looking at doing polling work, looking at how different parts of the population by race and ethnicity feel about the COVID vaccine. I'm sure we'll talk about that later, as well as opportunities to improve access to care and quality of care. Finally,
we also look at international models, whether it's payment models and payment approaches or delivery models, and find ways that we can, glean some of those lessons and bring them to the United States and translate them to improve healthcare and integration of care in the United States. So I'm really looking forward to the discussion, and thanks again.
Thank you so much, Melinda. I have had a number of roles overseeing development at nonprofit organizations serving the Latino community, and I'm so grateful for the work of the Commonwealth Fund. You mentioned the pivot that you had to do during the pandemic, and I just want to recognize philanthropy's pivot has helped to carry nonprofit organizations in service to their communities throughout this pandemic in a way that I think will give us lessons learned for years to come. I heard time and time again so many funders who dropped program requirements, grant requirements to allow for unlimited, unrestricted funds for administrative expenses and the unexpected needs within the nonprofit sector. I want to recognize the work that you're doing in this space specifically and stay with you for a moment for our next question. Can you talk a little bit about the challenges and opportunities that COVID-19 exposed within the United States health system, and what policies would make the biggest impact in addressing these areas? It's easy to talk about challenges, but I agree that this experience has exposed opportunities as well for funders, for technology, for nonprofits, and how we deliver services. Can you go a bit more into that?
I can, and then you should also wave if I'm taking too long, because this is a big topic. So no problem. So there are a number of crises that a lot of us talk about, but there are a number of crises that have been exposed, not the least of which is, problems with our health insurance coverage, right? The second would be with our public health system and how we have underinvested in public health for so long, and how, as a result, public health failed to quickly identify and control the spread of the coronavirus. And that's partially our fault because of our lack of investment. And there's no national public health information system, electronic or otherwise, that enables authorities to identify regional variation in the demand for and supply of resources critical to managing COVID-19. A number of people so far have already talked about how COVID has exposed the disparities by race and ethnicity. What's so important is to recognize that while that has brought it to the forefront, a lot of those disparities are entrenched in our system. So it's really just given oxygen to allow us to talk about them and bring them to the forefront more clearly. And I'll get to how to kind of address some of those. And then the other piece, which I think is really important, and Dr. Keck talked about this as well, is how COVID has really also exposed kind of the problems we have at the front line, whether we're talking about the direct care workforce or the primary care practices that people say they trust and they want to go to. So I know those are all problems, and but when we start thinking about some of the solutions, I'll start backwards. So thinking about the frontline workforce, we need to recognize that we need the critical service these people play, and let's acknowledge that they are overwhelmingly women, and they are women of color. A large proportion of them are themselves on public assistance. So we are undervaluing and underinvesting in our direct care workforce. So one of the things, and so if we recognize that we pay these people more and give them greater protection, financial security, it will be a double intervention, both for those that they serve and for our system, as well as also for themselves. When we also think about some of the ways in which we need to kind of work with our delivery systems that are providing care and help them address some of the disparities in our existing system. A number of that includes how they collect data, but it's not just the collection of information by race and ethnicity, but it's also the reporting and engagement of the community. It's also about how they pay their workforce as well, their relationship with community-based organizations, their as well as also their role in as leaders in the community in talking about and raising awareness to the role that racism has played in this country and in healthcare. So raising awareness and then thinking and having a plan to kind of put systems and policies in place that would help to dismantle racism. So part of it's about systems, and some part of it's about processes, and part of it is about policy. Again, like in the community, and how we also partner. The last thing I'll also just say, what's also been exposed is how, how we need to break down these silos between healthcare, public health, and social service. So much of what drives health is actually on the social service side. And so we've also, historically underinvested in a lot of the human services. And it's not just enough to screen someone for food insecurity. You have to screen for food insecurity. You have to help identify places where they can find more and suitable food, to address that insecurity, and then also have a feedback loop to monitor that over time. So, and connecting that and with their healthcare providers and with the broader team, as well as also having the information system as part of our surveillance for public health to see how we're doing broadly. So there are a lot more issues to cover, but those are just some of them.
Absolutely.
I guess one more thing, sorry, and then I'll be quiet. If there was one thing we were going to do, though, it would be the insurance coverage part. That's the one thing I started with, and just say how our reliance on employer-based coverage is really kind of shown that we need we need universal coverage in this country, and we need to kind of fill those gaps between the states that have not expanded Medicaid, as well as also for the individuals below 100% of poverty. And there are a number of proposals being discussed right now that would help to fill that coverage gap. But all these other things that we talk about in terms of delivery system reform and payment reform and high performance, it really relies as a first step with having good health insurance coverage. Thanks.
Absolutely. I think the greatest opportunity that the pandemic laid bare for all to see is the disparity in systems and racial inequities in our communities that now funders and policymakers are now coming online to see what those who've worked in the Latino community have always known. Mike, Melinda mentioned insurance. The uninsured rate is now 8.5% of the population, down from 16% in 2010, the year that the landmark Affordable Care Act became law. Where are we right now with the pandemic? We know that it's not over. It's exposed a lot of fissures in our system, and now we're dealing with the aftermath. Can you talk a bit more about that?
Yeah, certainly. I'll build off of what Melinda said, which was a really fantastic overview of so many important issues. As I mentioned at the beginning, this just exposed, as you said, the fissures in the system. Now we kind of can't turn away from them. We've all seen them, and I feel like the pandemic really allowed, particularly frontline providers like myself. We felt them in one way. We felt them differently now as a result of the pandemic. So I think a lot of us across the healthcare policy ecosystem were very, very worried about the loss of coverage that was going to result from the pandemic. We're thankful to see some of the uptick now in folks getting back on coverage or getting covered. And as Melinda said, through it's sometimes a bit of patchwork of insurance. I think insurance coverage is one important component of care, but we also know that it doesn't always equal care. So that's a critical thing as well. I see that in the emergency department all the time. People that have health insurance, but they don't have access to primary care, or they do have access to primary care, but they come to the emergency department because it's the most convenient, the time that the doctor's offices are available. So there's all sorts of issues to really unpack here. I'll say, just putting on my industry perspective hat, what we are really working on is how can we leverage the pandemic, the once in a century, hopefully global pandemic. I certainly don't want to have another one of these this century, but the fact that we've lived through this now, what did we learn? What has worked? What can we do as an industry? And I think one thing, just to put a positive note on it, industry has really responded in an incredible way. The private sector came to the table. The fact that we're able to develop therapeutics and vaccines very, very quickly, that's something we don't want to lose, right? So being prepared to respond to future pandemics is really, really critical. How can we build on the resiliency in the healthcare system, in the private sector in particular, to remain prepared for future pandemics? But the second is, making medicines more affordable is a really, really critical aspect of our platform and of our work. And Cynthia mentioned this at the beginning. There are reforms that are, in our mind, reasonable, sort of low-hanging fruit, things we've been talking about for many, many years. Putting an out-of-pocket cap in Medicare Part D, for example, spreading out the costs in Medicare to make sure that they're understandable for folks so they can budget for them. There are sort of supply chain reforms that we can use to make sure insurance is really working better for individuals. So all sorts of aspects in the insurance reform, making medicines more affordable bucket that I think we can sort of all agree on. And I think, part of this, the beauty of this is bringing folks that might have diverse viewpoints, but what can we all agree to? What can we all agree on? And I think some of the areas that we've tried to put forward in our Pharma sort of better way agenda fit that bill. And that is not even speaking to the third part, which is how can we work together to build a more just, equitable healthcare system. So sort of in three parts, the way we're approaching it is, staying prepared, building a more resilient system to be prepared for future pandemics, making medicines more affordable, and then working together to build a more just, equitable healthcare system.
Thank you. Cynthia, I'm wondering if you have anything to add from Eli Lilly's perspective. Earlier, we talked about the pivot in philanthropy. I'm wondering if there's been a comparable pivot for what Eli Lilly is now focusing on as it relates to this moment in time in the pandemic.
Yeah, there has been on the philanthropy front with Lilly and some of our support and partnerships, definitely. But I think one of the biggest pivots for us was when the pandemic kind of took hold, knowing, just how susceptible people with diabetes and other chronic illnesses were to COVID. And the fact that, we had medications in that space and really felt the obligation to ensure that people could afford their insulin, for example, which is a life-saving medication, right? I think, during the pandemic, we introduced our Lilly Insulin Value Program, which essentially helped anyone that was eligible to buy their monthly prescription of Lilly insulin for $35 if they had commercial insurance or no insurance. In addition to that, the Senior Savings Model Program, which allowed people participating in Medicare Part D plans to get their insulin for $35 per prescription, and that's regardless of whether you use one vial, 8 vials, or multiple pens. That was a really kind of pivotal moment, I think, for people who, again, were being impacted not only health-wise but financially by the pandemic, and really needed options, right, to be able to get their life-saving medication. There are also other tools and resources like half-priced non-branded insulin that we made available, automatic discounts at the pharmacy counter, and then partnerships with organizations like the Lilly Cares Foundation, which we donate insulin to make available to people to be able to get their insulin for free if they qualify, and Bertha, social care network that connects people with lots of different services, like getting rides to their doctor or pharmacy, so that in multiple languages, by the way, over 100 languages, to be able to connect them to those critical services that go beyond the medication, right? And not only that, but there's lots of other programs like getinsulin.org is a website where people can be connected with people with diabetes can be connected to insulin access and affordability options that go beyond Lilly, right? Other manufacturers as well. So, all of those were very important for us, in addition to other more local community pilots that really looked at the social determinants of health. The Diabetes Impact Project is one that I will name here that's taking place locally, where we look to address the statement that where you live shouldn't determine how long you live. After we saw some data that showed that, that there were pockets in neighborhoods, 3 particular neighborhoods in central Indianapolis that had a disparity there in terms of their life expectancy. If you just went a few miles up the road, that wasn't the case. And so really kind of looking and working with those local organizations, health organizations, the government, et cetera, to put forward a pilot to help us address the needs. And by the way, diabetes was overly indexed in those populations as well. So those are just a few of the examples that I would offer here in terms of the way that Lilly pivoted on this front.
Yeah, a few, but so much. What a great impact in our communities. Thank you so much for that. We heard clinical trials referenced a number of times in our panelists' presentations. Marianne, I want to turn it over to you. What are some of the initiatives that Genentech is doing to ensure the diversity of those clinical trials? And how has that shifted during COVID? How can all patients have access to clinical trials while we're in the pandemic?
Thank you, Yvette. Absolutely. So I believe in having diversity in clinical trials, not only because it means improving access to care for all patients, but it also means how we as an industry innovate in science. And I was alluding to that earlier in my last comment. So some of the interventions that we put in place through this company-wide initiative called Advancing in Inclusive Research is really thinking outside the box on how we can tackle different aspects of the clinical research arena. So thinking about recruiting more patients or representative populations by prioritizing our clinical development interventions. Thinking about how can we enhance the diversity of the data that we collect so we can really match the patient population to the disease, and then we can potentially enhance what we call personalized healthcare, thinking that not every patient with a similar disease should be treated the same. And then with those considerations in mind, you can actually develop or optimize the treatment plan that will ensure the better outcomes for that specific patient. Then building external coalitions and partnerships that even Mike was alluding to. We need to work with the communities where the Latinx community actually is. And then thinking about, can we approach diverse institutions? We tend to think clinical research equal academic center, and that will continue to exist. But trying to then bring the clinical trial or partnering with community sites to then think if there's a way that we can treat a larger population of underserved community that is often more from where the minority racial or ethnicity groups are living. So a little bit of what we then started doing during the pandemic is rethinking ourselves. How do we do clinical trials? And the traditional way we can do or conduct a clinical trial might fit some of the areas. We had to pivot it a little bit during the pandemic, thinking about patients not wanting to go to hospitals where the pandemic was being conducted, patients actually living far away, and then how then we can leverage some of the technology components to include and make sure that patients will still participate in clinical trials. And that's what this whole concept about decentralized clinical trials came into the picture for Genentech. And so one example I can share is in mid-May from this year, we announced a partnership with the Veterans Affairs in Durham, where we were announcing this collaboration between the VA and Genentech to really launch a virtual proof of concept study where we can deliver personalized healthcare treatment for veterans with lung cancer and prostate cancer. So thinking about how you can leverage a custom technology program or platform that is integrating different tools such as e-consent, telehealth or telemedicine, wearable devices or remote monitoring, that we can think about, is there a way that we can bring the trial to where the patient is? And then with that, improve the quality of care of veterans. And one thing that we're discussing throughout this panel is a lot about representation of Latinx community. But the Latinx community can also live in what we define as rural or highly rural populations. So there's a component of a geographic location that we need to address as well to make sure that we really include everybody in our clinical trials, regardless of what their race is, but also where they live.
So you clearly talked about technology, and technology is something that the 1918 Spanish flu didn't have. So we have that to our advantage. I want to talk a little bit, Melinda, as the nonprofit sector really kicked into high gear to serve this newest need in their communities. The nonprofit sector's helpers often look like you, grant makers who are investing in underserved communities, often communities of color, where the most vulnerable are weighing the greatest risk. I'm curious if there are any lessons from the field or examples from the field that you see for how organizations and communities are leveraging technology for better outcomes.
Absolutely. I think two things. Both as part of this public health emergency, the federal government relaxed a number of rules and increased flexibilities to allow for what we call telehealth. As you know, telehealth, as well as so that people did, because people weren't going in person, to get healthcare services, and technology was critical to that. And it really exposed, kind of going back to this whole theme around kind of disparities and deficiencies, about how actually like broadband access is an equity issue, which was actually why some of the investments in a number of the COVID-related bills kind of invested in greater broadband. So there are a number of examples too where it's not just telehealth from like person to clinician, but also like kind of across the team, so that there could be, direct care workers or community health workers who are lay people who are trained to kind of help connect people with services. They were going out into the community with phones and iPads and whatnot, and connecting people with needed services, both the social service side as well as kind of connecting them and giving them access to some of those, to technology to give them access to their clinical care team. That just being one example. Another also opportunity that we saw, which is maybe a little bit low tech and sounds kind of Marcus Welby-esque, but it's, it was also kind of more home-based care. And really more than anything that, what we saw both with the telehealth and the home care is how quickly how quickly our communities and our clinicians could pivot to access these to access services in ways that, everyone had been somewhat reluctant to do so, to be perfectly honest, previously. So really saw a number of ways in which, in particular, people started accessing care using technology and communicating across the team. And it wouldn't just be with the healthcare team, but it would also, as I said, kind of include, someone mentioned earlier, Aunt Bertha, which is a social service aggregator app, but there's also, Unite Us and other similar ones that would enable people to, whether it be the provider team or the families, to access some of those social services and connect people to the social services.
Thank you so much. You all are making me so hopeful. I don't typically equate science and hope, but all of you and the work that you're doing is giving us great promise for the future. And once we're out of this pandemic, all of the lessons that you've learned and how you will take them and apply them for the benefit of Latino communities across the country. Before we turn it over into our final session, I want to remind the audience to submit your questions in the chat. We are heading into our final questions, formal questions, and then we will turn it over to questions from the audience. So I want to wrap us up before we move over to that audience Q&A. Our attention for this panel discussion was drawn to a post-coronavirus world, understanding that a call to action is clear, specific, and urgent. Panelists, what call to action will leave the community better than where we started? And I'll start with you, Marianne.
I love the question. Call to action, I can think of many, many different things, but I would phrase it in one, be bold. I think we need to think differently. The way we were thinking before, it's not going to take us anywhere. So if there's a time to innovate and think outside the box, it's now. And then the other one is understanding that for us to thrive and really try to think how we can better serve our Latino community, we can't do this alone. This is not a Pharma initiative or an academic center, a community center, or regulators. We really need to work together, and establishing those partnerships, it's key to really make sure that we can ensure and deliver access to everyone who deserves it. And so that inclusivity component is going to come up by us bringing together all of our efforts in a collective movement to really do this as fast as we could possibly do it.
Thank you. Cynthia, call to action.
Yeah, I couldn't agree more with Marianne in terms of working together. I mean, this has been a prime example of how we've had to partner creatively, innovatively, quickly, urgently across the board, right, and spectrum in ways that we hadn't before. So using those learnings and experiences and continuing to act in that manner moving forward as we can is going to be critical. I think the other thing that I would say is, taking advantage of the programs and assistance that are in place, like the Navigator program, right, to help connect people to insurance options. Medicare enrollment is coming up, so how do we help our Latino communities know what their options are there and ensure that they're picking plans that cover their medications? In addition to that, just requesting more in terms of how we treat Latino community and all patients with respect to guideline-based care. Right. So here's an example, right? Diabetes does impact Latinos disproportionately, but we also know that they have some, they don't have the best outcomes. And that's because sometimes we're complacent with care and don't move and progress them along sufficiently or quickly enough. And so I think addressing issues like that would be also very important.
Thank you so much. Mike?
Thank you. Well, kind of where I started here, I think we are in a very different place today than we were at the start of the pandemic, right? Clearly, we have treatments and vaccines that are helping us come out of it, but we're not done yet, right? We have these incredible therapeutics, we have these incredible vaccines, but as I said at the outset, far too many people are being impacted by COVID-19 now, and so we need to continue all the work that we've done to get us to this point, because we're not through it yet. I would say, again, we couldn't turn away from the inequities that we saw early on in the pandemic, and now I think it's on us also to not forget those. We can't come out of it and forget what we saw over the last 18 months, and then I also think build on what worked. That's always, there have been some successes in the last year and a half with innovative clinical trial design, with increased diversity in clinical trial design. I really, I'm taken by the example that Marianne gave around the Actemra study, which is an anti-inflammatory medicine that we use to treat really critically ill individuals that are in the ICU with COVID-19. There are others like we could talk about monoclonal antibody examples from Cynthia's company, or certainly vaccines, where diversity in clinical trials was very much focused on. But the other component of it is we have a lot to learn or a lot to build on from vaccine outreach, making sure that we're reaching communities of color in terms of outreaching on the vaccine, making sure we're getting individuals to take that vaccine from trusted voices. It can't be top down with everyone. It's certainly people that wanted the vaccine rushed to get it early on, but everyone sort of since then has required a specific outreach strategy, and one that we shouldn't also forget. We have to continue to work with trusted voices in the medical community to build and address these issues. So, in summary, I would say different place today than we are, but we can't forget where we came from, and we have to build on the successes that we had over the last 18 months where they did exist.
Thank you. Melinda, what call to action do you want to share with the audience from where you sit?
I would say that the pandemic refocused our attention on how the healthcare system can improve some of these health inequities. And so I said this earlier, but I really think the first step that's so critical before we kind of get to almost everything else is expanding health insurance coverage. And universal coverage would improve access to primary care, to preventive care services, which would in turn reduce the prevalence and severity of chronic illness that exacerbate a lot of the health effects that we see. And even, a lot has been accomplished through the Affordable Care Act. There's more to be done. And I'd say when we look at communities, if you overlay the communities that have gaps in coverage, they are the communities where we're seeing surges of COVID-19. And then when you look at those surges, we're seeing they're disproportionately affecting low-income people, people of color. And so really, if we want to kind of work backwards and and just kind of better protect Americans, particularly people of color and particularly low-income communities, we would start with health insurance coverage and expanding Medicaid and in enhancing the subsidies would go a long way towards doing that.
Thank you, Melinda. We're now turning it over to audience Q&A, and I'm going to begin with a question for you, Dr. Ibarra. We heard conflicting messages at the beginning of the pandemic. Things like masks don't work, then actually they do work, then wear 2 masks. There, of course, has been a gross misinformation effort happening, especially on social media, that sometimes gets picked up by mainstream media. What advice can you offer to help build trust in medicine and medical institutions amongst the Latino community?
Oh, there is so much there to really get at. I wish I had a silver bullet answer for this. Aside from, I think those of us that are communicating about science have to really be clear about when we're sure about things and when we're not. And most of the times, we're really not sure. There are answers to a lot of questions, but I think being open and honest and communicating when we do or we don't know things is really, really critical. I think back to the early days of the pandemic, and I myself am sort of struck by the fact that I didn't really early on pick up on, wearing a mask would probably be a good idea. I remember going to the grocery store in early March and not even really thinking about it, even though at that point we had started to shift to wearing masks in the healthcare setting. So I think part of it is we just have to be really, really cognizant of where we're sure about things, which again is not very many things, and where we have uncertainty. And I think that preps us to have open and honest conversations with individuals. There's obviously a difference between sort of public health communication and the communication that we're having with our patients, sort of one-on-one. So I think just, again, that level of confidence and that level of humility is really, really important. The other is and I mentioned this a bit in my last question, is making sure that where we have sort of trusted voices, where we've built relationships in communities, where we've built up expertise, we really should not lose that coming out of the pandemic. I think vaccine outreach, again, is one really good example where we've built relationships, we have built expertise, among, healthcare workers, but then also non-healthcare workers too, to learn about this, to talk about it. And I think that is the type of thing that we really need to not lose sight of, particularly as we're coming out of the pandemic for all sorts of conditions, not just infectious diseases, cancer, early screening for chronic diseases. There's a variety of situations where the type of infrastructure we've built to get COVID-19 vaccines into arms could be very, very useful for other disease areas. So I appreciate the question. Again, I don't have a silver bullet answer for it, but I think humility is one really, really important aspect of it, and just being honest when we're not certain.
I love that. Cynthia, we have a few questions that I'm going to direct at you and combine them if I can. Most people have not paid direct out-of-pocket cost for the COVID vaccine. But what more can be done to ensure everyone has affordable medicines like insulin? And can you elaborate a bit more on how Eli Lilly has addressed the issue of medicine affordability during the pandemic?
Sure. Yes. I mean, I think I talked a little bit about this already, right? So in general, I think ensuring that the communities have access to their insurance options out there and available. I mentioned the Navigator program. So the Biden administration, it's my understanding, recently quadrupled the number of navigators, helping people to secure insurance coverage. So I think it's critical to ensure that that Latino communities can be connected with their options through a program such as that. Medicare open enrollment, again, as an example, right, for Medicare plans that are participating, if your insulin is covered under that plan, you can get it for $35 a month as part of that program. And so ensuring that you know about that at the time of enrollment and are checking on those stipulations is critically important. Lilly in particular, I mentioned the suite of solutions that we have. The Lilly Insulin Value Program started in March of 2020 when COVID was beginning, and but it's part of our ongoing suite of solutions. So there's no reason today through the Medicare savings model program, as well as the Lilly offerings, that anybody should be paying more than $35 for their Lilly insulin. If you are, then I would encourage all of us to help direct folks to the Lilly Diabetes Solution Center. It's a center that we have. You can call and talk to an operator that will try to meet your unique needs in multiple languages as well, and or on the website. So those are just some of the options that Lilly has put forward. But as I mentioned, there's other organizations. We know that not everyone is on a Lilly insulin, and so ensuring that you're connecting with getinsulin.org and other resources there are also very important. In addition to that, I think, maybe Marianne, you talked a little bit about this earlier, right? Like ensuring that people are empowered by the information that they have, the resources and tools that they have. I think this is critically important. And I know that's something that Lilly is also very, serious about, is ensuring that we have the insights around Latinx communities and other non-majority communities that we're building into our the way that we approach everything from development and clinical trials all the way through to commercialization and the information that we provide to patients, and that you're taking that very cultural specific lens into account as you're creating materials and communicating and engaging with the patients that we hope to serve. So thank you.
Thank you so much. Melinda, earlier in your remarks, you mentioned the workforce. We have a question about how we are or should be addressing rising rates of burnout in the healthcare workforce. Is the Commonwealth Fund focused on that, or have you seen anything from peers?
Definitely. We tend not to focus, just as the Commonwealth Fund is a foundation, so people know, not focus on the nursing school, PA school what we call the pipeline, but rather actually more about training and addressing the needs of the existing, or trying to address the needs of the existing workforce. It tends to be incorporated into other activities, whether it is our delivery system reform work or our work around the Medicare program, the Medicaid program areas we do for our duals, because it's so important to keep track of the workforce. I would say that some of what is so important for us, is starting with this workforce and promoting economic and educational opportunities for the workforce. Also recognizing there is provider bias, unintended, but that we need to reduce it. We need to address it. Improving the training for professionals and staff, and, diversifying the workforce at leadership levels. So if we also provided better income, more loan forgiveness, we might also see more people, go into the workforce, which would also help alleviate which would also help alleviate some of that burden and exhaustion. We definitely see a lot of exhaustion in the community. I have a number of sister foundations that are exclusively focused on workforce. We tend to address it as part of a comprehensive package, along with looking at payment approaches and financing and, better insurance and equity. So we take, a different lens, but it is super important, and definitely something that we all need to, as a nation, really address.
Agreed. Marianne, what are the barriers that prevent life-saving resources from reaching Latino communities? And how can we work to ensure Spanish-speaking Latinos receive more information?
Thank you, Yvette, for the question. And we can take it from every single angle. I think the essence goes into thinking about that patients that we have in this country come from different backgrounds, speak different languages. And I mentioned this during the discussion, even our physiology, right? The way a body, like a Latino community body, will process a patient or metabolize a drug is completely different than a Caucasian, an African American, an Asian American, etc. So thinking about from the very inception of any project, and that's something that at Genentech we really try to take into consideration in the medical affairs group. So whether is it a late stage trial, a development trial, or any project that we're trying to think is like, how can we really bring the voice of the patient from its inception to its execution, to the little components of, and Cynthia was alluding in her discussion too, the many languages they're incorporating into their work. So thinking about when you do an e-consent for a trial, for example, you're consenting a patient, you have to do it in multiple languages, and our language is Spanish. So we have to make sure that we bring and we adapt our projects or initiatives to where the patient is. And that could be, yes, like I mentioned, we utilize technology to then meet the patient where they are. It could be addressing different languages. It could be even the way we explain our trial. We have some videos that we've created for patients before even they consent to a clinical trial that are more interactive and are more visual than reading a 10-page consenting form. So it's really making sure that we understand each patient's need and each patient's population. The way an oncology patient might have a series of requirements, it's completely different than a patient with a chronic disease, multiple sclerosis. So it's the same thing that I think, and point everything that we've learned during the pandemic to do different and to incorporate it in our existing initiatives. And we know it works. How do we translate that into the future to make sure that everything that we're creating is really an inclusivity of everybody?
Thank you. So we are here this afternoon at the Congressional Hispanic Caucus Institute's Leadership Conference. I'm going to throw this question out to all of you. What is the role that federal, state, and local governments should take to address racial inequities and disparities in health outcomes? What's the role then of the delivery systems? Mike, we can start with you.
Sure. Well, maybe just starting with our sort of role in the delivery system. I mentioned the Pharma Better Way agenda, which we released last year, earlier this year, I'm sorry. And, I think there are some key components in there that we want to take a leading role in. How can we better leverage diversity in clinical trials? How can we build an industry workforce that represents the diversity of communities that we're serving? How can we better invest in rigorous data, measurement, the infrastructure that's needed to sort of collect and report data that'll help us address these health inequities? I think that's probably the one that could best be helped by authorities, is how can we work to collect better data? Certainly there's an industry role to be played there. Maybe, I know we're running out of time, but one thing I could just mention, I participated in one of the COVID-19 vaccine clinical trials, and I learned so much just personally about the experience that individuals go through. And I think that there's a lot that could be leveraged. And that's one of the efforts that we have sort of moving forward is how can we, again, build on the things that worked? There were things like digital clinical trials that Marianne mentioned, electronic consenting, monitoring remotely. All of those things are efforts that I think industry has to undertake. And we'll work with authorities to, if we have better data, if we can measure some of these questions a little bit, in more depth, get more granular, then I think that'll help us, work more collaboratively to address the health disparities that we're all trying to solve for.
Melinda, do you have thoughts there?
Sure. The federal government could, at the federal level anyway, we could develop, implement, and regularly update kind of a national healthcare preparedness strategy, one that teams up public health and healthcare and social services to better protect patients and communities. This strategy would, delineate a governance structure with clear definitions for the local government, the state government, and the federal responsibilities during an emergency. It would lay out data collection and reporting requirements for these different levels of government. It would develop surge capacity, for example, and strategy, as well as inventory and allocation programs, for necessary supplies and equipment. So it's critical, and I think you started with this, it's critical that we keep the pandemic at the forefront, even when, we eventually will be on the other side of this. And it's having guidelines and stringent requirements for and monitoring accountability of these healthcare plans. Mike mentioned data. It's actually critical and crucial. It can get very wonky and technical very quickly, but we need to strengthen our surveillance system to better track the epidemic and non-epidemic illnesses and their potential impact. And this needs to be done in concert with state and local governments. I serve on my local board of health. We need to, as I mentioned earlier, improve the information that we collect by race and ethnicity. we have to be really mindful that we can't just ask people to give us things. We need to actually give it back, report it back, and act on it, make sure they have the resources. So report it back to the end users, engage the community-based organizations, and give resources so that local coalitions and communities can act on how to improve care as a result of that information. So we hear time and time again, what gets measured is what gets done. It is critically important, but we also have to recognize that it's not just about the collection. It's about what you do with the data. It's about also engendering trust with those from whom you are collecting that information. How do you do that? You work with local organizations, you work with community-based organizations, and you make also people feel safe. So that you're not going to use that information for other purposes, but really just, that you're not going to monetize it or put them at any kind of risk, in terms with the justice system or whatnot. And so it's really enhanced surveillance is important, but how we use it and building the trust to kind of get meaningful information and act on it is equally important.
I love that point so much. Let's not use the community for the data that we need in order to achieve our goals and our work, but also how we can use that data to benefit the community and return it right back. How can we inform and empower community residents using statistics and resources from their own communities? I've always said our communities have assets as well, that underserved and underprivileged communities have a lot to offer. Thank you so much to our panelists. That concludes our Q&A portion of this discussion, but I want to give you all the opportunity to have 1 minute each to share a final thought. And we'll begin with you, Cynthia.
Sure, thank you. Well, I would like to, again, thank you, say thank you to the CHCI for the invitation to be here, my fellow panelists, and as you as well, Yvette, thank you very much. I would just maybe reiterate that delivering life-saving medicines for Lilly is just the start of what we do, right? And so we believe that all people should have access to care and affordable medicines to manage their conditions and live healthier lives. And so that commitment is to providing solutions and working with others in the healthcare system and groups like CHCI to make sure people with conditions like diabetes and others have access to affordable options to help them with their treatment goals. So we would ask for the help in sharing information about some of the resources that I mentioned, the Lilly Diabetes Solution Center, Lilly Insulin Value Program, Senior Savings Model, but also in support of broader legislative reform that I know Dr. Ibata mentioned earlier to ensure that everyone can afford life-saving medication like insulin. And also as you think about the connection between other chronic diseases like obesity as well, right? There's work that's being done with Representative Raul Ruiz around the Treat and Reduce Obesity Act that really will help people get parity in terms of access to diseases like obesity and really kind of ensure that people can live much better lives and not suffer from the complications that come with that. So thank you very much again for the opportunity to be here.
Thank you so much. Dr. Ibata, 1 minute, final thoughts.
Sure, I'll go fast. Well, thank you again, Yvette, and thanks to all the panelists. It was really great to hear your expertise. As an ER doc, I can't imagine working in the pandemic today were it not for the advances of the industry. Having effective therapeutics and vaccines has made my life so much different in a better way. At the same time, as Melinda mentioned, some of the burnout we're experiencing is because we don't have yet high enough uptake of some of those most valuable interventions, vaccines, most notable. That said, the work that industry has is not by any means done. The breakthrough vaccine research and therapeutic research continues. And as I mentioned, we want to work together. We want to, put forward common sense reforms that can help A, end the pandemic, B, make medicines more affordable, and 3, build a more just and equitable healthcare system. So thanks again to CHCI and everyone for this opportunity. Appreciate it.
Excellent. Dr. Chacon.
Thank you, Yvette. I can't train enough, really, the fact that we really need to think about novel ways of delivering care to all patients started before the pandemic, definitely made an in pandemic, and we need to continue after. So it's platforms such as this and the rich discussion that we've had over the last hour that it's going to help us all together to think of what is the roadmap that we can really build to move toward to a medicine where we really think it's a medicine of inclusive healthcare, where we really can have fascinating innovations and learnings and really push each other to make sure that what we're doing benefits all patients and the patient that actually needs it. So I think this is the very beginning of what we should be incorporating into the near future. And once again, I appreciate you moderating the session and the discussion with my fellow panelists and to CHCI for the opportunity.
Thank you. We're so grateful to have you. And closing with Melinda, final thoughts.
Thank you so much, and to CHCI and to the rest of you and to Yvette. I want to remind everyone of at least 4 of the crises that we, kind of were heightened during COVID-19. So one around insurance coverage, another around our underinvestment in public health, a third around the racial and ethnic disparities that we've all talked about, and the importance of equity. And the fourth, is around the front lines, those at the front lines. And so really the call to action would be some combination of expanding insurance coverage, modernizing, investing in and updating kind of our information system to allow healthcare, public health, and social service to talk to one another, to kind of come up with detailed plans that we hold ourselves accountable for, and our government officials and the front line, everyone, for advancing equity, and really thinking hard about what does that mean, and working together with communities, getting feedback, getting input from them about their experiences, how to overcome some of the long-standing racism that has existed so that we can have a more equitable system. And finally, on the front lines, they are the trusted resource. They're often, if we're talking about the direct care workforce, they're often people of color. They're underpaid. We need to also invest in them. If we're talking about the primary care practices, they're also underinvested in, and they also need our support. So again, thinking through the front lines, the public health, the racial inequity, and the insurance coverage, that would be my overall call to action. And thank you so much for your time and for listening today.
With that, I want to thank our amazing panelists for this thoughtful discussion: Cynthia Cardona, Mike Ibarra, Mary Ann Chacon, and Melinda Abrams. Thank you all for joining us.
Thank you very much.
As our panelists have exited, I want to remind our audience to please keep tweeting about the conference at CHCI HHM21. We have a full slate of sessions this afternoon, and our evening plenary discussion, Latino Stories, New Narratives in American Media, begins at 5 p.m. Eastern Standard Time. If you know people who would be interested in joining this conference today and tomorrow in the conference but haven't signed up yet, encourage them to log in and register at chci.org. And finally, please join our virtual 44th Annual Awards Gala celebration on Thursday evening, September 23rd from 6:30 p.m. to 8 p.m. Again, encourage your friends, colleagues, and networks to register for the conference. Don't forget to join us at 5 p.m. today for Latino Stories, New Narratives in American Media, and be sure to join our 44th Annual Awards Gala celebration this Thursday from 6:30 p.m. to 8 p.m. Again, I'm Yvette Nunes, Deputy Vice President of Communications and Marketing with Unidos US. It was my great honor to host this discussion, and I encourage you all to take the information that you heard here this afternoon and see how we can all apply it in the communities that we serve. Thank you and have a great rest of your day.